Hello, and welcome back to my YouTube channel. My name is John Rose, and in this video, I'm going to take a closer look at the common flaw in functional medicine, traditional Chinese medicine, Ayurvedic medicine. In fact, this is the common flaw in virtually every protocol out there that claims they got a solution for our illnesses and ill behaviors. Now, in order to understand the common flaw, you need to understand a little bit about my philosophy. I try to keep things real simple. There's only two groups of needs we have to satisfy. We have to understand that living systems are subject to the law of cause and effect, just like all matter is subject to Newton's third law of motion, the law of action and reaction. And once you understand how cause and effect plays in, if you think about it in a little bit more detail, there's actually three ways we can screw up the law of cause and effect. And yes, I've done videos on this, and I talk about it all the time in my videos because it's an important concept for us to understand. Because the common flaw in all these protocols I listed is the number one way the vast majority of this planet screws up the law of cause and effect. Now, how can you screw up the law of cause and effect? You reap what you sow. You can't interfere with it, or can you? Well, that's part of what our so-called experts are doing now. It's a magic act, allopathic medicine. They're interfering with the body's communication process so the symptoms don't manifest. And they're doing that because they're told that diseases are due to, most of them at least, are due to inappropriate signals. Don't blame the greasy fries, blame biology. If they teach our young kids, medical students early on, that disease is an inappropriate signal, then they think it's okay to interfere with the cause and effect. And that's what most drugs do, and I've gone over this many, many times. Most drugs are blockers and inhibitors, and they interfere with our body's lock and key communication system, where we produce hormones and enzymes to communicate to the organs that have receptor sites, and they either block the lock or they destroy the keys. Voila, it's magic. The symptom doesn't manifest. Now we have this new cutting edge group, this functional medicine guys, who are trying to trick us into thinking that, no, we're not going to treat the symptoms anymore. We're going to go after the cause. I've been studying this for a long time. Anybody who thinks they have a solution to our problems, I want to study what you study, whether or not it's related to health or not. But if it is about health, I really want to know, what do you guys think? Now, the whole spiel here with functional medicine is that we look at the cause. But really, do you? Do you understand the difference between a primary cause and a subsequent cause? No, you don't. And then, if you do, which you don't, you still are guilty of the first of the three ways we screw up the law of cause and effect. And that's when you guys don't understand what comes before the cause. Remember, three stages of knowledge. What we acquire, apply, and manifest. Thoughts, actions, reactions. Beliefs, causes, effects, actions, reactions. Belief system, lifestyle choices, feedback system. Functional medicine, we're looking at the lifestyle choices. Well, the problem we all have is we're all making mistakes, but we don't know they're mistakes. So you look in that second stage of knowledge and see if we're making mistakes, and you go, oh, we're not making any mistakes, because you have false knowledge up here. You think cooking food is okay. You think eating animals is okay. You don't have knowledge of how to live. So that's the first way most people screw up the law of cause and effect. So I'm applying cause and effect. I understand we reap what we sow, but I'm not making any mistakes. I'm eating the best diet I can. So that's the biggest problem that virtually every protocol has out there, and some of them know they're guilty of it, like allopathic medicine. They're guilty of modus ponens, putting the cart before the horse for a problem that's 100% within our control. But oh, we're going to trick you guys, come up with functional medicine. We're looking at the cause. And then, if you study someone like Dr. Mark Hyman, and I got a file on functional medicine, and the only related file I have to that is a Dr. Mark Hyman, who's kind of their promoter, one of the big promoters of this system. And you look at his file and you go, okay, what most of you doctors don't know is that most of these chronic diseases are coming from the thyroid not working. We got to go to the cause. Subsequent cause, not primary cause. And that's what you guys are told, aren't you? Ask anybody, especially a doctor, what's the number one cause of blindness in America? What's their answer? Diabetes. What's the number one cause of gangrene, amputations, cutting people's arms and legs off? Number one cause? Diabetes. High blood sugar. It's a symptom. It's an effect that can become a subsequent cause. That's the ripple effect. So there's the law of cause and effect that we're all subject to. But then there's a ripple effect where effects can become causes. That's called the causal loop. The diabetes is a classic example, and I've used it many times in my other videos. But it's not the primary cause. You can't blame gangrene on diabetes. You got to find out what's causing the diabetes. You can't blame all these chronic conditions on low thyroid, because what's causing the low thyroid? Well, let's see what Mark has to say. Well, okay, they do know you got to look at environmental toxins. They understand we have 280, babies are born with 287 chemicals in the umbilical cord. Yeah, they're looking at the environment, and we're looking at the lifestyle choices. But again, if you don't have knowledge of how to live, you don't understand what the primary cause is. And you take a look at his list. There's a lot of causes for thyroid not working. And what was one of his main causes? Inflammation. That's an effect. That's a symptom. It's an effect that ripples around because of the causal loop. Now it's a subsequent cause. So here we are. We're not looking at the effects. We're looking at the cause. Your problem, according to Hyman, your thyroid's not working. Why isn't it working? It's inflammation. Subsequent cause. Subsequent cause is not a primary cause. We're being tricked and fooled. We're looking at the causes. No, you're not. You can't look at the causes if you don't have knowledge of how to live, and you don't have it. None of you guys that are in all these other fields are applying the law of cause and effect in the right way, because you don't know you're screwing it up. You see? 3 ways we can screw up the law of cause and effect. Allopathic medicine, remember 3 stages of knowledge, cause and effect. Right in between the cause and effect in my special teaching tool, I label that portal 106. That's where they stuck allopathic doctors to interfere with the body's communication process, so it's magic, the symptom doesn't manifest. So the first way we don't have, we screw up the law of cause and effect, we don't know the knowledge of how to live in the first stage. And then we screw it up again because we're in between the cause and the effect. We're screwing it up. It's an inappropriate signal. It's like we're supposed to do that. Disease is wrong. We got to interfere with it. This is the whole mentality is wrong. They got it all backwards. I asked the doctor the other day, you don't study the lymph system, do you? Oh, yeah, we do. No, you don't. Perhaps I need to be more explicit. There's the technical and there's the practical. Don't waste your time with the technical. You guys don't study the practical. You don't understand what it's doing. I've read your textbooks. I understand how little you understand and how you're being tricked into looking at a subsequent cause, thinking it's a primary cause, or thinking we know how a system works, but you don't. You don't even know there's a big lymph system at the base of our spine, a triangle lymph system. It was only a few years back where they say, we got to rewrite the textbooks. We've had another lymph system up in the brain. We didn't know that was there. You don't know anything. You may well understand and be able to articulate the technical aspects of the lymph system, but you don't know how it works. You don't know it's backing up. It's so simple. It's mind-boggling. It's mind-boggling. So there's one more way we can screw up the law of cause and effect. And that's when we don't understand what comes after the effect. That's the ripple effect. That's why we have 2 groups of needs. First group of needs is based on the law of cause and effect. There's 12 main essential needs. One of them, piece 33, is our environment. 11 ways we interact with our environment, so that's how I came up with 12 essential needs. But if we make a mistake in that second stage of knowledge and we end up with a problem, then that effect circles back around. We have a ripple effect. Now we have another group of needs. We have 2 additional temporary needs. 12 essential, 2 additional temporary needs. 10 subsequent needs because we're sick and disconnected. And then there are subsequent causes that don't go away just because we remove the primary cause. Most of the protocols I'm talking about are the art. There's a science going upstream, law of cause and effect. There's the art, the ripple effect. Almost every protocol out there is what I put under the art. They're dealing with a subsequent cause because they don't have knowledge of how to live. So in addition to having this knowledge of how to live, we need to have knowledge of how to adapt. Now, a lot of groups out there are saying we're going to look at cause and effect, and the only one I've ever seen that does a decent job of it are the natural hygienists. They recognize most people don't have the knowledge of how to live, and that the doctors are over here in 106 interfering with the body's, palliating the symptoms. But their flaw is they throw all the other protocols in the same group as allopathic doctors, and they don't belong there because they're dealing with a subsequent cause. What doctors are doing, allopathic doctors, they're just interfering with the body's communication system. It's a magic act. It's a trick. It's an illusion to make it look like what they're doing works. We do have to deal with those subsequent causes sometimes. That's the art of solving problems or healing. Remember, most of our problems are self-inflicted. When we remove the primary causes, most of our problems go away. But if you've been banging your head up against the wall 3 times a day for 50 years, over 50,000 head bangs, You finally learn you shouldn't bang your head, and you can stop that immediately. You remove the primary causes overnight. But what about that big lump on your head? You're damaged. Now the question is, let's hope it's not permanent damage, it's just temporary impairment. Remember, the body is trying to heal itself in the disease process. This is what the doctors don't understand. 5 main symptoms of inflammation: redness, swelling, 2 fluids to the rescue. Then we have pain and fever, and then we have impairment of function. Now, someone asked me to comment on a video recently about some guy talking about, in essence, biochemical individuality. I'm a big fan of that. I say that there's a oneness of disease based on the law of cause and effect, and then there's the uniqueness of disease based on that ripple effect. We're all damaged individually. And almost everybody I've ever studied who pushes the biological individuality concept assumes that it's permanent, and it's not. And that's what makes the art of solving problems a little tricky, because we got to know when to stop the art so the body can do what it needs to do. Because in most cases, we're only temporarily impaired. But nonetheless, we have to realize we can't change what we got overnight. There is a time and a place to use allopathic medicine. There's a time and a place to use acupuncture and herbs, homeopathic medicines. There's a lot of things we can use those for. But when we don't understand the significance of this knowledge of how to live, when we don't understand all the ramifications that come from cooking our food, we're missing such a big piece of the puzzle that life from here on out is an illusion, a flat-out illusion. You have to understand the first cause, the one big mistake that allowed us to make other mistakes. And it would be nice to think that there is a group of doctors that are open to this information. I hope that you guys that call yourself functional medicine people, practitioners, whatever you want to call yourselves, are open enough to realize the difference between a primary cause and a subsequent cause. And you can't understand that until you realize knowledge of how to live. That we have a species-specific diet. Mark Hyman, you go to his website, he calls himself a pegan, paleo and vegan. Wait a second. Do you know what vegan means? It doesn't include the animals. Or are you referring to what you recommend to people? Well, it makes sense to go paleo. Yeah, we shouldn't eat processed foods. Of course not. And the thing about you guys that are in no matter what field you're in, if you can just get your patients to stop eating processed foods, it's going to be a miracle. I said before, at any given day, at any moment, I could create a dozen diets in my mind, and they could all be, half of them could be diametrically opposed to the others. And they're all going to get great results simply because out of the 5 mistakes we're making, I'm going to stop you guys making the 4th, processing the foods. Now, I did a special video on the difference between a paleo and a vegan. And the paleo people are getting great results because they corrected 3 mistakes. But they're still eating animals. Or they're cooking their food, they're eating animals. Now, the vegans, if they're a healthy vegan, they too at best have corrected 3 mistakes. Except this time, they're not eating the animals and the processed foods and the chemicals, but they are still eating grains. So, but the problem with both vegans, as Mark Hyman points out, you know, they're drinking Cokes and potato chips and all that processed stuff, so that's not a healthy diet, obviously. The point here is we got to correct all 5 mistakes, and most of us don't want to admit that. There's only one way to wrap your brain around these 5 main mistakes, and that is to stop making them on a temporary basis. That's what the solid food vacation on juices is all about. Most of us are simply not in a position to evaluate what we're doing and what we need to do. And Mark, if you're so concerned about the thyroid, one of my most fascinating files is on the thyroid gland because it's full of testimonials of people embracing a raw vegan diet. And what do they say? The more raw food I eat, the less medication I need. Well, I messed up, ate more cooked food, I need more medication again. Coached a woman about a half dozen years ago or so, had thyroid issues. She started off a juice fast. I go, yeah, I always like it when people start with the most aggressive way to do this, solid food vacation on juices. She goes back to her doctor when she was around on day 30, in fact, and they see her walking in the door, and they go, wow, you look incredible. You lost all this weight, you're glowing, wow. What are you doing? Let's just check you out. And they go, wow, in 10 years that you've been coming here, 10 years, this is the first time your body temperature's been normal. and of course she told them what she was doing. And they go, oh wow. And anyway, she goes back when she was on day 60. And they see her come in, and they go, wow, you look even better. And your numbers will keep getting better. But we think you should stop doing it. We don't know anything about it, but we think you should stop doing it. Patient healed is money lost. What's your true motives? The sad thing about reality on this planet is there is a solution. I'm not going to use the word cure because that belongs in a black magic bag of poisons. There is a solution for virtually every problem that you bozos are trying to treat. Problem is you can't make any money at it. It'll put you out of business. You will go from some of the richest and most respected to the poorest and most persecuted for what you're doing. Because if we were to put or rate professions on a scale of 1 to 10 relative to the harm you guys do, where 1's the worst and 10 is the least, the system's in charge right now. You're coming in at level number 1. You're the number 1 cause of death in America. Number 1 cause of death in America. And that doesn't include how many people are dying from the other next causes, heart disease and cancer, that could have been saved if our so-called experts had knowledge of how to live. Now, where would functional medicine come along? Oh, we're sliding up from 1 to 2? Can you do better? I think you can. You guys have got to clean up the mess that you're in. You have to admit that your education is being controlled by a small group of people that own and control everything. They've turned our hospitals into temples of sacrifice. If you really care, you should understand the harm you're doing, injecting liquid fire into people in the name of medicine. Chemotherapy. Got to attack that cancer, right? Hell, they used mustard gas in the war. Hey, now we'll use it for chemotherapy. How in the world can anyone in their right mind use these poisons and actually think in any way, shape, or form that's going to help people? Only very ignorant people who don't know the cause of disease. Most people don't know the cause of disease. Most allopathic doctors don't know. Most functional doctors don't know. Most Ayurvedic doctors don't know. Most traditional Chinese doctors don't know. Most acupuncturists don't know. Most herbalists don't know. That's why we still suffer. It's not complicated. We have a species-specific diet. Every animal on this planet has about a dozen anatomical characteristics that clearly determine what kind of food they're supposed to eat. And there's no question what we're supposed to eat. There's no question whatsoever. There's no sense of even discussing this with anybody if you can't understand how denial is not helping you realize these basic characteristics. And of course, it gets confusing because of the ripple effect. The species-specific diet is relative to the law of cause and effect. We have anatomical limitations that we've been given at birth. But then we make mistakes and we damage ourselves, either on a temporary basis or possibly permanent. And now it gets more complicated. Our ideal diet, our species-specific diet, is only ideal in an ideal world, and we don't live there anymore. Our society has been damaged. The environment's been damaged. We've been damaged individually. Yes, there is a uniqueness of the disease. There is this biochemical individuality. But realize, my friends, that for the vast majority of us, that's only temporary. And it won't last long. So you play an extremely active role when it comes to figuring out how to heal yourself. You know your body better than anyone else. You know what you're doing and what kind of results you're getting. And you've got to become knowledgeable about why you're sick and what it's going to take to get healthy. Because you are the only one who can eat for yourself and think for yourself and sleep and exercise and sunshine and do all the things we need to do. And it's up to you to know the difference between a primary cause and a subsequent cause. Most people don't know. They're screwing up the law of cause and effect. And as I mentioned, the natural hygienists, they said, yep, most people don't have the knowledge of how to live, and these doctors are interfering with the communication process, but they lack the knowledge of how to adapt. That's their major flaw. No one in that movement was ever able to articulate well enough, until now, me, that we have another group of needs. Now we have to have knowledge of how to adapt. And that's the secret to life right there. Once we can find that knowledge of how to live and that knowledge of how to adapt and apply both of those and go through the transformation ourselves and get excited about sharing this profound message with everyone you can, that's when you know we're in for a treat.